Low turnout today. Right. Good morning, everybody. Jeroen Weimar here to give you the daily COVID update for the state of Victoria. And look, I hope everybody, with the wonderful weather and the big step towards easing restrictions yesterday, I hope everybody made the most of a beautiful day yesterday and got out and enjoyed the wonderful things that we still have on offer now in Melbourne. Vaccination progress continues to be really strong in the state, and we've now have well over 90%, 90.9% of Victorians have now had their first dose of vaccine, and 72.5% of Victorians aged over the age of 16 are now fully vaccinated. In fact, I'm delighted to say that over 4 million Victorians are now fully vaccinated. That puts us in a really strong position to continue the easing of restrictions, and 39,126 vaccines were allocated and were provided at our state hubs yesterday. However, I am afraid to say that we are clearly not out of the woods yet, and sadly 9 Victorians passed away yesterday due to, or partially due to COVID. That includes 1 man in his 60s, 3 women and 2 men in their 70s, 1 woman in her 80s, and 2 women in their 90s. And we pass on our deepest condolences to their families at this very sad time. We have 770 Victorians that are currently in hospital. That includes 144 in intensive care and 90 on ventilators. And we continue to see that it's the unvaccinated who are ending up in hospital. Yesterday, of the 770 people in hospital, 86% were not fully vaccinated. And of the 144 in intensive care yesterday, 93% were not fully vaccinated. And again, it highlights time and time again that vaccination really is the best way to protect yourself from the ongoing pandemic that we see all around us. Another strong day in testing yesterday, 72,858 tests processed yesterday, 89% of those with results by the next day. My thanks again to everybody who continues to come out and get tested. And as we start to open up, as we all start to socialise more and do all those wonderful things that are now possible again, please remember, if you have any symptoms whatsoever, whether you're vaccinated or not, please make sure you are tested. That is the best way you can continue to protect yourself and those around you. In terms of cases, 1,750 new cases in the last 24 hours. 2 of those acquired from overseas, 1,748, therefore local cases. And we now have over 23,000 active cases of coronavirus in the state. And again, that highlights that, although we can continue to now enjoy these freedoms, please remember there are a lot of people with COVID out there in our community. We are delighted and glad that so many of them are getting tested and that they're isolating effectively when they find out they have the virus. But it's so important that we all act with some restraint and respect, that we are likely to be seeing people around us who may have COVID. Get yourself vaccinated, and let's keep all these good practices going over the days and weeks ahead. I do need to confirm that we did do some more data reconciliation yesterday around our case numbers. In fact, yesterday's number was reported as 2189, was actually 2159. So I apologise for a slight imbalance in our data reporting. There'll be full details in the show release this afternoon, but the actual number for yesterday was 2159. In terms of overall case trends and case patterns, they're very similar to where they've been over recent days and weeks. I won't go into all those details. We continue to see high active case growth, particularly within the southeast of Melbourne. But what I can say, if I look over the case numbers over the last 7 days, we are continuing to see a fairly stable trend over that period of time. Our rolling average is around 1,925 over the last 7 days. That's entirely consistent with the Burnett modelling at this point in time. And of course, our behaviours over the coming days and weeks will determine where those case numbers go. We're obviously very keen to keep them under constraint and to get them down a bit as we continue to go forward on our vaccination programme. Hospitalisations have also stabilised over the last 7 days. It's been a very welcome trend to see actually a lower number today, 770, compared to the numbers we've seen over the last few days. And my huge thanks to everybody working, particularly on the front line in our hospitals dealing with COVID patients, but our wider healthcare workforce for the phenomenal work they're doing to support those with COVID and those with other conditions who need their care and attention at this time. One angle we are picking up is we are seeing a growth in regional cases, and we're seeing a growth in younger people catching COVID. We're seeing of all the cases today, over 14% are in regional Victoria. That's a significant increase on where we've been over recent days. What we're also seeing is far younger people catching COVID, so a greater proportion of younger people in our case numbers. If I look at Metro, 29% of all cases yesterday are under the age of 19. So these are our children and our students who are clearly very active in the community. In regional Victoria, 38% of all the cases are under the age of 19. And we continue to see that profile in the other age groups. For Metro, 2/3 of all positive cases are now under the age of 40. And for regional, 3/4 of all cases are under the age of 40. So please, I'd call out to the younger Victorians amongst us. You are particularly vulnerable at this point in time in running into friends and associates who are COVID positive. Please take every care to make sure you don't become one of those statistics. Key regional locations of interest in Latrobe City. We've had 40 more cases today, or in today's numbers. We have a total active cases just under 300, 283. With a number of different settings, including a number of household settings, but also education settings and some school settings coming forward. We've also seen a significant number of cases in Wodonga, with 21 new daily cases, 62 active cases in Wodonga, but very closely related, of course, to our colleagues in Albury. And I'd like to thank our colleagues in New South Wales Health and all the local parties in Wodonga and Albury for their close cooperation. We're managing this as an interrelated set of outbreaks and clusters, as a very good cross-border work going on to support the community up there. Pleased to confirm that all the work in Mildura continues to pay off. 10 active cases, or 10 new cases today, really high vaccination levels, phenomenal work done by the local partners and agencies down there. We continue to work very actively in the Mildura area to hold on to those gains made over the last 10 days or so. Real focus now going forward, of course, continues to be vaccination. Over 4 million Victorians fully vaccinated. Even if I look at, we're increasingly focused on the 12 and over population. They're the ones that are eligible. If I look at that bigger cohort, over 90% of Victorians over 12 are first dose vaccinated, over 70% fully vaccinated for that bigger cohort. There are only 440,000 second doses to go before we hit 80% double dose vaccination. We really want to get those 440,000 doses done as quickly as we possibly can over the days ahead, and let's really charge into that 80% double vaccination milestone as quickly as possible. There are so many places to go to get your second dose done if you're not there to do it yet. There are over 91 different state facilities where you can get your second dose across our pop-up hubs and across our state clinics, but there are also literally thousands of GPs and community pharmacies where you can go and get your second dose done. So please, I'd encourage all of us now, let's not slacken off, let's increase the pace as we get to not only our 80% milestone, but also the 90% vaccination milestone that really is only, I suspect, a few weeks behind getting to 80% in the coming week or 10 days. A lot of energy around that at the moment, and my thanks to everybody working on this fantastic vaccination programme and everybody who's rolling up their sleeve over the coming days to be part of one of the most highly vaccinated societies anywhere in the world. Particular call out or particular shout out today to the Western Bulldogs. We're back at the Whitton Oval again. It's becoming a very regular place for us to do our vaccination drives. We've got we delivered over 2,000 doses at the beginning of October in a first dose blitz. We're back again this weekend to return match. So please come and finish your vaccination journey at the Whitton Oval this weekend if you're due. Or if you haven't had your first dose yet, please come and get your first dose there as well. We will continue to drive really hard and to enable people to get their first doses done over the coming days and weeks. We've also got 17 school pop-ups happening this weekend at various locations across the city and across regional Victoria, including in Mildura. So again, please, if that's convenient to you, come to your local school pop-up and get your first or second dose done there. We've also got a whole bunch of new mini pops running next week, including at our partners at Headspace, and in particular shout out to the Headspace organisation, really for encouraging young people to have a safe and a confident and a secure place to come and get your vaccination done. And we'll be with Headspace at Sunshine and Glenroy, Greensborough and Frankston over the course of next week. And if that's the right place for you to come and get your vaccination, we'd be delighted to see you there. In fact, the pop-up program, these new community-led facilities have been so successful that we will have done 106 pop-ups around the state by the end of this weekend, and we will continue to run more because we really want to make sure that every single Victorian has every possible opportunity to get their vaccination done so they can be protected as we continue to open up the state over the days ahead. And then a couple of other shout-outs from me. One is to the St Kilda vaccination team who ran a particular pop-up for people with complex needs. Over 105 doses, but it's 105 really valuable doses to support people who are particularly at risk from coronavirus. And at the other end of the spectrum, Palm Plaza Dandenong, 20,000 doses delivered through that pop-up site over the space of 5 weeks. Just a phenomenal program of work. And the kind of stories we're hearing out of our pop-up program is that we're reaching people who otherwise just wouldn't have got round to getting vaccinated. We're dealing with mothers with young children, where the children have a safe and effective place to play while mum gets her vaccination done. We're seeing tradies coming in who've been, either encouraged by their mates or encouraged by their family to make that step and to go somewhere which is convenient to them. But we're also seeing people who've been, for 20 or 30 years, have been so afraid of needles and injections that they have not availed themselves of any vaccine whatsoever, but they've been encouraged and supported and finding a safe place to come and get their vaccination done, which is an important part of them to join the rest of us as we move forward with some confidence. So as we enjoy the second day of Greater Freedoms, please go out and use them. Please go out and enjoy the hospital opportunities, the greater freedoms we all have, but please make sure we keep the momentum up for getting our vaccinations done to 80% and 90% and beyond. And please remember that COVID is real when it's still amongst us. So please, there are fewer restrictions. Please bear those in mind. Let's continue the really great performance we've seen from so many of us to do the right thing, to minimise the spread and to move forward with confidence. Happy to take any questions.
You mentioned that hospitalisations have stabilised despite the rolling average of, say, 1,900 cases. Why do you think that is?
Look, I think there's been some phenomenal work done by our hospitals and healthcare services across the state to really look at how we treat people with COVID and how we support people with COVID. I think they deserve the greatest plaudits for managing that so well. What we're also seeing is, an increasing, we're seeing a slightly younger age profile of new cases coming in. So with 3/4 of cases in regional Vic being under the age of 40, 2/3 of those in Melbourne under the age of 40. We know younger people are less likely to end up in hospital, particularly if they're vaccinated. So we think those are some of the factors, but we'll be interesting to see how this pans out over the weeks ahead. The best way to reduce hospital numbers is to reduce case numbers. So the fewer people that get COVID, the fewer people run the risk of being in hospital with COVID, and we'd really want to make sure we hold on to that trend.
In terms of when we watch for the impact of these new freedoms taking effect, things like perhaps cases, transmission at hospitality sites, and when kids going back to school, what's the time period that you watch for that? Is it sort of a 2-week lag, a 1-week lag? Yeah, look, typically we see sort of a 7 to 14-day lag between significant one-off events and how that translates into either case numbers or not into case numbers as may be. So we'll be very interested to see how the numbers move over the week or two ahead. Of course, this is all factored into our Burnett modelling, and right now, if I look at our 7-day average, we are bang on, actually slightly under the Burnett modelling for where we expected our case numbers to be. Burnett indicates that we should see a reduction in our case numbers over the next few weeks, and then we see a rise as we pass that 80% vaccination point and people's freedoms continue to ease off, that we should expect to see a rise in cases, particularly amongst that small minority that continue to be unvaccinated at that point in time. So that's going to be a critical part of the journey for us. We're obviously concerned about rising numbers in some of those settings. There's a lot of work happening now in schools. We're seeing significant numbers of schools now where cases are coming in, being identified, and then other kids having to isolate as primary close contact. So we're concerned about that, and obviously we'll manage that very closely over the weeks ahead. I don't know if you've seen some vision from Chapel Street last night. There was a lot of young people gathered, a bit of dancing on taxis, dancing out in the street. There's a lot of excitement, people are letting off steam. What was your takeaway from seeing those pictures? Yeah, look, I wasn't there, but I think I understand it. I think we all understand it. We've been locked down for 70+ days on the last lockdown, and that's a challenging thing for all of us to do. Look, I would urge people, enjoy the freedoms, absolutely. Look, we've all worked so damn hard to get to this point, to get that vaccination to such high levels. So I think we absolutely earn and deserve those greater freedoms, and we should use them to the full extent. But let's not forget we've still got COVID out there in the community. So that mask wearing, that distancing, that discipline does remain important. And I just urge people, you can dance on taxis as far as I'm concerned, but just please be safe in how you do it.
Or COVID safe in how you do it.
Jeroen, you say that the young people are driving a lot of these case numbers. Are
Yep.
those young people getting sick?
Well, they're getting sick enough, Blake, in order to come forward and get tested. So that's how they're being identified. And and a big shout out to people who continue that testing discipline, because that allows us to identify those cases, to make sure that they're isolated from the rest of us, and to slow down that rate of transmission. We're not expecting to go back to COVID zero, but we still need to do all we can to slow down the rate of transmission. But they're not ending up in our hospital numbers. So although we do have some young people in hospital, we don't have huge numbers. We're not seeing a growing share of young people ending up in hospital. But obviously any infectious disease is of concern, and particularly when we're seeing it coming to a school environment. What I'd urge parents to do, and I'm sure that most of us as parents just want to get our kids back into school at any price. If our kids are being symptomatic, if they're showing those kind of symptoms, please get them tested for their benefit, but also for the benefit of the wider school community.
Jeroen, exciting news for racing fans today with the Derby Day crowd. Can you just explain the thinking behind only having 5,500 though, when 3 days later we're going to have 10,000 at the Melbourne Cup?
Yeah, look, I think we're moving at really fast speed now in terms of how we start to open up towards wider events. We've got, as you say, Derby Day. We've got obviously the Cup Day. We've also got the My Music Bowl event. So we're stepping through those gates really, really quickly. With all the planning around Derby Day now, we wanted to do it at a slightly smaller number to see how that was going to operate for us, and we'll use that to pivot into the Cup Day arrangement. So we think that's appropriate. We've worked very closely with the VRC to set up that trial in an effective and safe way. And I think, look, everyone will be delighted that we can have a crowd at Derby Day, and I'm sure they'll have a wonderful day's worth of racing.
There's been criticism in the past that we keep prioritising sport, whether it be AFL still being able to play. Now, obviously, we've got big crowds at racing. Do you think we've got the priorities straight with allowing these things to go ahead?
Oh, look, I think that's not really my place to comment on how that plays out. I think what I would say is we're absolutely, I think increasingly we can see, if you look at the programme ahead of us, that Victoria is increasingly open for business again, and we're putting confidence in our vaccination status and keeping that vaccination programme going further. So the quicker we vaccinate, the more we keep that momentum going forward, the quicker we get to those 80% and 90% thresholds. That opens up even more opportunities to do good things, including for both the sporting sector, the cultural sector, and others. And I think we've been very clear, and I think Minister Pearson mentioned it the other day. We're open for how do we support live music events and other arts events to start to open up again. That's what the Maya event's about. We will want to get into those indoor events as soon as we possibly can. As we get to those 80-90% thresholds, those things become much more possible.
So obviously you had, you're on racing.
Oh, no, it's okay.
70%, we're obviously enjoying it. It's been 24 hours of us having it, but we're already looking to 80%. 440,000 doses to get us there. How many days do we need to do it? I'm guessing you're watching those forward bookings.
Oh, look, we're watching them very closely. So the forward booking's looking great, but we've still got tens of thousands of appointments available for the next week for people to get their first dose or their second dose done. So there are appointments available. There are a number of walk-ups available. The GPs and the pharmacists are keen to do this. So I'd love nothing better than to set some new records for daily vaccination numbers over the next 7, 8, 9 days to get us towards that 80% dose and then to kick on to that 90% deadline. Let's not forget there's some good stuff that happens at 90% on the roadmap as well. So both those targets are really important. Look, we'll obviously watch it day by day to see how quickly those numbers move around. And the sooner we get to 80%, the sooner those freedoms come to bear.
Do we have 440,000 booked in between now and say next Friday?
We don't, certainly not in the state system. We don't have 440,000 booked in. I think we have in the region of probably about 180, 200,000 booked in. We can confirm that in the CHO release. So we have a good number of bookings booked into our forward program that we're excited about. We have capacity to do more, but we also, of course, we don't see the bookings in GPs and in community pharmacy. But I'm confident based on the trends we've seen over the last few days. If I look at the 3-week interval and the number of second doses that are due, the number of bookings we have in already, I'm very confident we'll get to that 80%, in the next week or so. So that feels like a really good place to get to. But the quicker we can do it, the better it will be.
The fact that we're going to have crowds at Derby Day and that we look like we are going to hit 80% ahead of schedule, is that an indication that perhaps we will be opening up a lot earlier or opening up a little bit more earlier than what we anticipated?
Yeah, look, I think we've always said that we're very keen to tie the roadmap has always been tied to hitting those vaccination thresholds, and I think that's worked because we hit 70% 6-7 days ahead of the original roadmap schedule, and I think that's because ultimately, I think all of us are desperate to get to those points, and Victorians have put a huge surge on. I think we've got one of the fastest rates of second doses anywhere in the country over the last 7 days. We're one of the fastest increasing vaccination rates of any country around the world. So that's great to see. We can all now. We can taste the benefits of success. We can see that those 80-90% deadlines are coming really close to us now. So I'm confident we'll get that momentum in place. I think we'll get there at some point next weekend, and that will be a great place to be.
Are you by yourself right now because the cabinet ministers are in a meeting about opening up earlier?
No, I'm by myself right now because I came down to see you guys. I'm not sure where all the cabinet ministers are, but they've got huge other jobs to do, and I'm sure they're doing them and focus on doing those at the moment.
You have got a second Saturday in a row, though, being asked the questions that we would be asking the minister.
Yep.
So are you hearing or are you being told to gear up for more than what the roadmap laid out at 80%?
No. Look, the answer's the same as last week, and I appreciate everybody followed me down to Casey Fields last weekend, and I appreciate people following me into the CBD this weekend. You guys know who's going to be here before you come here, so there's no surprises there. As I said before, as I said then, it's my job to run the vaccination programme, it's my job to run the overall COVID response, and I'm giving you an operational update on how we're going. Government will make the announcements when they're ready to make the announcements and when they've got news to share.
What does the state of play at the moment mean for crowds into summer cricket and so forth?
Look, I think that will depend really over what happens over the coming weeks. So if we look, there are two scenarios. If we all drive hard at 80 and 90% and get well beyond 90%, that opens up a world of opportunity for the summer, for December, January, and February. And I think we'd all be very excited about that. The trial at Derby Day, the work we're doing on Cup Day, all those enabling events all give us greater confidence, and we'll want to see also how the virus responds to that. There's a lot of grounds for optimism because I think the vaccination status gives us absolute confidence, but also the increasing weather, the increasing use of outdoor events. I think we're hopeful that will enable us to really enjoy the summer and get the most out of it. We don't have any details yet on exactly of how Boxing Day is going to work and the test and the rest of the programme, but we're ambitious about it because we've all worked hard through a long, dark winter, and we need to now move on and get the place back up and running again.
Say we do get up to 90% vaccination. What are we looking at? Are we looking at 100% crowd for Boxing Day, or is that really optimistic?
Yeah, that's not a call for me. I think there's a general sense within the public health team that says we want to back Victorians to do the right thing, and part of that is getting vaccinated. That's where the real momentum is at. If we can do that, if we can see that these case numbers don't go crazy, if we can ensure that we keep our hospitalisation numbers as low as possible so we can keep Victorians out of hospital. And the way we do that is by getting more people vaccinated. If all those things happen over the coming weeks, then we have a really good run in to see how that's going to play and what it means for December, and then events like the Boxing Day test and other things that happen in January. So I think the timing for us is in our favour. We get to see how we're all going to behave. If we see lots of chapel streets and if we see a spike of infections in the next 2 or 3 weeks, that's going to be problematic. That's something we then have to find ways of putting back in. But if we're all going to act safely from a COVID point of view over the next 3 or 4 weeks, if we get the vaccination levels to where we really want to get them to, then I think we'll be in a really good place for the summer.
There's been reports of many businesses through Business Victoria not receiving grants, and some have said that they were receiving $2,800 a week. Now that's gone down from October 1st to $1,000 a week. What do you make of that?
Yeah, that's not on my radar, I'm afraid. I don't have that program in my portfolio. Happy to go and ask the questions for you and to come back to you.
In terms of booster shots, are you being asked to start planning for that and how we roll that out to Victorians?
There's certainly, obviously we're very keen to get advice from the TGA and from ATAGI and the Commonwealth around the programme around booster shots. We obviously see the developments in other parts of the world where that's looking like an increasing part of all of our futures, particularly for those who are more vulnerable, and recognising that we started this vaccination programme all the way back in February, so there are people now who are well past the 6-month point for both their doses of vaccination. So look, we're very keen to get that advice and to get that clarity, and we will absolutely through our vaccination programme respond in kind. We are absolutely determined to ensure that, having worked so hard to get so many people vaccinated and to maintain that momentum, we'll want to make sure that any booster programme or top-up programme is delivered both through the GP system but also through the state system.
How important is it in Victoria at the moment to get those booster shots approved?
Well, look, it's important to us because we've got the vaccine, right? So we are now in a world where we've got plentiful supplies of Pfizer and Moderna vaccine within both the state system and within the primary care system. That's a great position to be in. So we have capacity to do first doses, second doses, and if the Commonwealth guidance is we need booster doses, we have the capacity to go and do that. But we need that guidance. We need the direction to go and do that. We can't just go off and shoot from the hip. It needs to be done in a properly controlled and clinically led way.
Is that too slow, the approval? I mean, 6 months is when vaccine waning begins. How much of a problem could... I'm not, as you know, Paul, I'm not a chief health officer. I'm always impatient to get things done. I'm always impatient to get on with the next stage of the programme, and I think the momentum is with us now, and particularly as we start to open up, if there are good clinical reasons, and that's a TGA role to play, not my role to play. If there are good clinical reasons for booster doses, then we'd want to be in the vanguard for making that happen.
Those who had AstraZeneca,
yeah,
given
like me,
we're not going to make it, be making it beyond next year. What's going to happen to them in terms of the booster shots? Do you know? So
I don't know. So again, we're waiting for TGA advice on that. Look, certainly what we're seeing, commentary from around the world we're seeing is that there's a very good role apparently for Pfizer to be a booster dose for those of us who've had AstraZeneca. But again, that's why we need that clear advice. We can't just improvise things as a state. This is a Commonwealth vaccination program. We're delighted to have played such a strong role within it. We're delighted to have done almost half of all the doses here in Victoria through the state system, and we're very keen to ensure that Victorians are protected. If booster doses are what is necessary, then we're very keen to get that done.
Obviously having these, particularly the set-up facilities, like the Royal Exhibition Building and Convention Centre, it takes a lot of humans and a lot of effort to make it roll. Are you planning for that to still be in place for the booster program? Is obviously you can't just turn that on and off.
No,
so
that's right.
Are you planning
that's
to
right.
be there for another year?
Yeah, look, I think it goes back to Paul's comment. Look, we've got, I think Victoria as a whole has got momentum, right? So our GPs are set up for it now. The pharmacists are set up for it. We're certainly set up for it with 91 different points of vaccination as I speak. So we've clearly got a momentum on that program. If I look at there's plenty for us to do over the next few weeks, but we are starting to see a bit of headroom now. The numbers will start to drop as we get through those second doses, as we get to 80%. So if the Commonwealth guidance is we need to do booster doses, now would be a good time to get on with that and to make that happen. I don't want to be sitting here in 3 or 4 weeks' time having to decommission facilities and decommission staff and then only to be asked X weeks later to go and set it up again. So now's a good time to do it. And if that advice comes soon, then we'll be in a good place to execute it.
Are there active conversations happening? I imagine.
Yeah, I mean, there's daily conversations we have with our colleagues in the Commonwealth, and this is, for the avoidance of doubt, we absolutely respect the role of the TGA and the TARGI in making these very difficult judgments and decisions, and I have every confidence that they'll do so, in a timely manner. Anything else? Too easy. Thank you all very much indeed. Nice to see you.
That's a new record, I think.
Do it again next Saturday if you want.
Holy dooly.
27.